Ministry of Health of Ukraine. Krok 2. Medicine. Year 2019, number 023. A 32-year-old woman complains of body weight loss despite her increased appetite, nervousness, and tremor of the extremities. Objectively, the skin is moist. The thyroid gland is diffusely enlarged. Painless, soft, and mobile. Blood test. Increased level of T3, T4, and thyroid-stimulating hormone. THS. What is the most likely diagnosis? A. Autoimmune, Hashimoto's, thyroiditis. B. Diffuse nontoxic goiter. C. Thyroid adenoma. D. Diffuse toxic goiter. E. Thyroid carcinoma. Diffuse toxic goiter is a condition with a diffusely enlarged thyroid gland in rubber-like consistency. Microscopically, the follicular cells are hypertrophic and hyperplastic with little colloid in them. Lymphocytes and plasma cells infiltrate into the gland and can ultimately aggregate into lymphoid follicles. Graves' disease is an autoimmune disorder that can cause hyperthyroidism, or overactive thyroid. Not all cases of diffuse toxic goiter are Graves' disease, but the majority are autoimmune in nature. In Graves' disease, antibodies are directed towards the thyroid-stimulating hormone receptor, TSHR, present on follicular cells. The chronic stimulation of these receptors results in the production of excess amounts of T3, T4, and enlargement of the thyroid gland or goiter. Hashimoto's thyroiditis is an autoimmune disorder that can cause hypothyroidism, or underactive thyroid. The body attacks its own immune system. Over time, it causes the thyroid to stop producing hormones, leading to hypothyroidism. Rarely, the disease can cause hyperthyroidism. Nontoxic goiter is a diffuse or nodular enlargement of the thyroid gland, but with no disturbance in the thyroid function. It is not due to inflammation or neoplasia. Risk factors: family history of goiters, iodine deficiency, history of radiation therapy to head or neck, especially during childhood. Types: diffuse, enlarging the whole thyroid gland; nodular, enlargement caused by nodules or lumps on the thyroid. Thyroid nodules are solid lumps or cysts filled with fluid or with colloid, a stored form of thyroid hormone that form within the thyroid. Most of them are not serious and do not cause symptoms. Only a small percentage of them with little fluid or colloid are more likely to be cancerous. Still, most solid nodules are not cancer. Some types of solid nodules, such as hyperplastic nodules and adenoma, have too many cells, but the cells are not cancer cells. Thyroid cancer is a disease in which malignant cancer cells form in the tissues of the thyroid gland. Thyroid nodules are common but usually are not cancer. The answer is D. Diffuse toxic goiter.